So we're here at the NAPC conference with NAPC Chair Dr Jonny Marshall. Okay, so I wanted to ask about your hopes for the conference and what a difference you think it could make.
I think a time when there are a number of challenges facing primary care around improving health services, improving patient experience and delivering productivity and value for money. We're really trying to get practices to understand they have a significant responsibility in affecting that change, and if they can get involved, we're likely to be much more successful and also much well received within the rest of the NHS. So I guess what I hope today is people will leave feeling inspired to go back home and take on the challenges in their everyday workplace.
So you've launched a manifesto at the conference for the first time, and I wanted to ask you about that and also about the idea of foundation practices.
The manifesto really is trying to recognise that practice-based commissioning has delivered a small amount of change in a few areas. But fundamentally, if we could get the benefits in service redesign spread across the whole of the NHS, we're going to be much better able to meet the challenges that I outlined. So the manifesto sets out a direction of devolving responsibility and accountability to practices so they could be more independent from PCTs in delivering new local health services. Within that context, we recognise that for every practice, there is a core responsibility for delivering high-quality primary care services and taking responsibility for how the actions of delivery in primary care influence the expenditure spent on other parts of the NHS. And the idea of recognising those practices that are providing a high-quality service and a high-quality management of NHS resources is what we wish to recognise within a foundation practice, so that as they demonstrate they are more and more able to deliver, so they gain greater independence in determining how local health services are delivered in partnership with their communities.
There's been a lot of discussion about smaller practices and whether they can take on the burden of PBC and whether that's something they should be able to opt out of. What's your opinion about this?
I think all practices have a really important role in terms of providing high quality primary care services and ensuring that their service appropriately uses additional NHS resources. And many of them may not have the capability or the capacity to start looking at the wider implications of demand management, of managing the budget. But I'm sure that all of them have the capability and the capacity to look at how they're performing. And we can see that in some areas, working in collaboration, there may be some practices who do take a lead in terms of service redesign and managing budgets, but that everybody needs to be involved in delivering high quality primary care. And we hope the support from perhaps larger practices or more advanced practices, for those practices who want to be part of this, who want to be part of improving their services, will really enable everyone to get the very best healthcare possible from their practice, whatever size.